Hey guys, welcome back to the channel. Hope you guys are doing good. In this video, we will discuss about the management and treatment of diabetes. So without wasting any more time, let's get started. Let's start with the management of diabetes. You will need to take steps to keep your risk factors under control and within the normal range, including keeping your blood glucose levels as near to normal as possible. Maintain your blood cholesterol and triglyceride levels as near the normal ranges as possible. And control your blood pressure. Blood pressure should not be over 140/90 mm of mercury. So, the question that arises is, how to keep these levels within the normal ranges? There are some easy steps you can follow to maintain everything within the normal ranges. Like by planning what you eat and following a healthy meal plan. There are various diets available nowadays to tackle with various illnesses. Like for diabetes, there are diets like the Mediterranean diet. This diet includes eating vegetables, whole grains, beans, fruits, healthy fats, and consuming low sugar. If you want a detailed video on the Mediterranean diet, drop a comment down below. Second way is to exercise regularly. I know you have heard a lot about exercising, but it has actual benefits in managing diabetes. Exercising for at least 30 minutes every day helps to reduce the risk of diabetes by at least 25%. Not only this, but physical activity also helps control blood sugar levels and lowers your risk of heart disease and nerve damage. Another interesting benefit of exercising is, if you have diabetes, being active makes your body more sensitive to insulin, which helps manage your sugar levels. Third way is to achieve a healthy weight. As we have already discussed, that major risk factor for type 2 diabetes is obesity. And not only diabetes, but obesity leads to other health problems like increased risk of heart diseases. So, keeping a healthy weight is crucial for general well-being of a person. The fourth way is to monitor your blood glucose and blood pressure levels at home. Fifth way, and one of the most important way in managing diabetes, is taking medication and insulin, if prescribed, and closely following recommendations on how and when to take it. And the last way is to quit smoking if you smoke. You already know the ill effects of smoking, but for now let's see how is smoking related to diabetes. The major chemical compound in cigarettes that keep you smoking is nicotine. Nicotine increases your blood sugar levels and make it harder to handle. People with diabetes who smoke often need larger doses of insulin to keep their blood sugar close to their target levels. These were some of the ways that you can follow regularly to keep diabetes under control. Now, let's discuss about the drugs which are given in diabetes. There are over 40 medications approved by the FDA in treatment of diabetes. We will discuss various classes of drugs which are given in the treatment. So the first class of drug include the Sulfonylureas. These drugs lower blood glucose by causing the pancreas to release more insulin. Example of these drugs include glimepiride and glipizide. Second class of drugs are the biguanides. These drugs reduce how much glucose the liver produces. It also improves how insulin works in the body and slows down the conversion of carbohydrates into sugar. Example of biguanides include the metformin hydrochloride. Third class of drugs include the alpha-glucosidase inhibitors. These drugs lower blood glucose by delaying the breakdown of carbohydrates and reducing glucose absorption in the small intestine. Example of these drugs include acarbose. Fourth class of drugs include the Thiazolidinediones. These drugs improve the way insulin works in the body by allowing more glucose to enter into the muscles, fat and the liver. Example of these drugs include the pioglitazone hydrochloride. Fifth class of drugs include the DPP-4 inhibitors. These drugs help your pancreas release more insulin after the meals. The example of these drugs include algoliptin and stigoliptin. And the last class of drug include the dopamine agonist. This medication lowers the amount of glucose released by the liver. The example includes bromocriptine. The diagnosis and treatment of diabetes is properly executed by your healthcare provider. All these medications which we have discussed need to be taken under medical supervision. Your healthcare provider will decide which medicine is best for you. Don't take any medicines without consulting your doctors because this will lead to serious consequences. So that is it for this video guys. Don't forget to subscribe the channel and follow us on Instagram. Links in the description.